Hey guys, this is Dr. Hub. Today we'll look at the lymphomas. Lymphomas and their etiology. So first we look at the H. pylori, that is a Helicobacter pylori. So under this, it involves the lymphoid neoplasm is a gastric maltoma. Then we look at the Epstein-Barr virus, EBV. Under EBV, what do we have? There is the Burkitt's lymphoma, that is BL. Then comes the post-organ transplant lymphoma, this post-organ transplant. And this is the lymphoma, post-organ transplant lymphoma. Next, there is also the primary CNS. This primary CNS, there is diffuse large B cell lymphoma. Next, there is also the Hodgkin's disease. There is Hodgkin's disease and it contains the mixed cellularity. Hodgkin's disease contains a mixed cellularity as well as a lymphocyte. The lymphocyte is depleted. Then there is also the extranodal NK. There is presence of the extranodal. So there is extranodal NK as well as the T cell lymphoma, and there is also the nasal type. Now we move on to the HIV. So under HIV, it includes a diffuse large cell. There is diffuse large B cell. There is diffuse large B cell lymphoma. And there is also the BL. BL stands for the Burkitt's lymphoma. Burkitt's lymphoma. Next, we are going to look at the hepatitis C. That is a Hep C. So hepatitis C, it includes a lymphoplasmacytic. So it's lymphoplasmacytic lymphoma. And what does it include? It includes the Waldenstrom's. It includes a Waldenstrom's macroglobulinemia, bulinemia. So this is under the hepatitis C. HIV, it was a diffuse large B cell lymphoma as well as a Burkitt's lymphoma. So now we'll look at the HHV8. So HHV8, what are the lymphoid neoplasms? It includes this primary effusion lymphoma, Next in line, we have the Kaposi sarcoma. Then there is also presence of the multicentric. There is multicentric, there is a Castleman. There is Castleman disease. Next, we move on to the gluten sensitivity. So gluten sensitivity or the celiac disease. So what does it include? It includes the enteropathy associated T cell lymphoma. This enteropathy associated T cell lymphoma. That is, it includes a small intestine. Then we look at the severe T cell disease. The severe T cell deficiency. So this includes the B cell lymphomas. Next, we move on to the HTLV1. So HTLV1, it contains the adult T cell leukemia, as well as the lymphoma.